There's an industry growing quietly in the shadows. No neon ads, no corporate PR, just private clinics, encrypted forums, and a promise: repair the body and upgrade it. They're called peptides, tiny chains of amino acids, worth billions. What began as medical research has become one of the most secretive profit engines of the 21st century. From medicine to money. In the 1980s, something subtle began in sterile labs. Researchers realized that short chains of amino acids, known as peptides, could mimic, tweak, or trigger biological signals the human body already uses. Some of these fragments nudged growth hormone pathways. Others promoted tissue repair, modulated inflammation, or even acted like mini hormones themselves. In those early days, the work was painstaking. Tiny trials, cautious dosing, decades of skepticism. The idea of a drug built from a peptide was still niche, regarded as risky, chemically fragile, difficult to manufacture. The world of small molecule drugs or large biologics overshadowed it. Then the tide turned. A 2022 review noted over 33 non-insulin peptide drugs had been approved worldwide since 2000. Meanwhile, the market noticed. One source estimates peptide therapeutics hit roughly $70 billion by 2019, and other forecasts place the broader peptide-derived market in the hundreds of billions. The landscape shifted from medical curiosity to commercial runway. An even deeper shift was underway. Patents started expiring. Manufacturing technology improved. Peptide synthesis became cheaper. Contract manufacturers in Asia and Europe ramped up peptide APIs. One market report estimates the peptide API sector valued at $9.2 billion in 2023 and projected to exceed $94 billion by 2034. As synthesis costs fell and logistics improved, a cascade began. Compounding pharmacies, outsourced labs, and eventually corners of the internet that preferred no regulation, minimal visibility. Here's where things become morally and commercially blurry. What began as therapy for the sick began to appeal to the healthy. An athlete hears, "recovery in half the time." A senior executive hears, "sleep deeper, focus sharper." The same molecule once used for rare disorders appears on so-called optimization menus. The boundary between medicine and performance starts to vanish. And here's the unglamorous chemistry truth many overlook. Peptides are fragile. You ingest them, and your body's enzymes try to break them apart. So chemists fight back, adding protective groups, modifying amino acid sequences, shifting how they're delivered. Some peptides are injected, others are bound to carriers so they survive longer in the body. That interplay between biological degradation and synthetic survival is the very reason this industry exists. So while the headlines speak of miracle recovery or youthful performance, the backbone of this shift was first invisible: manufacturing optimization, supply chain evolution, intellectual property expiry. In short, therapy became commodity, and the commodity market noticed. The hidden market. Beyond the gleaming labs and GMP badges lies a second, much larger network, a gray market for peptides, built on lax rules, cross-border synthesis, and exploitation of loopholes. On paper, everything looks legal. Vials labeled "for research only," tiny print disclaimers, limited transparency. But underneath that veneer, thousands of purchasers inject peptides without approval, standardized dosing, or meaningful safety monitoring. In fact, academic investigation has documented this shift in stark detail. One global study of synthetic peptide hormones found they were openly advertised on mainstream e-commerce platforms such as Amazon, eBay, and Alibaba, often spelled "not for human consumption" or "for research only," yet pitched for human optimization. Consider the contradiction. Supply is licit, use is often illicit. That tension is precisely how a shadow economy grows, not in hidden warehouses alone, but in plain sight. The data remain purposefully opaque, one reason the market escapes clear regulation. But the fragments we can see point to explosive growth. Analysts describe triple-digit growth online for peptides between the late 2010s and early 2020s, as wellness influencers route clients through private Telegram groups, biohacking forums, and luxury health clubs. Meanwhile, the regulated market quietly marches on, and the unregulated rides in its wake. You're looking at two streams, one official, one unofficial, intertwined, mutually accelerating. Consider the manufacturing hubs, major synthesis sites in Shenzhen, Singapore, and parts of Eastern Europe. They ship peptide APIs cheaply across jurisdictions. Are these facilities GMP certified? Sometimes yes. Often it's marketing. Purity levels? Frequently questionable. One public health review warns that human enhancement drugs represent vast gray zones with minimal oversight and inconsistent quality control. In short, capital flows, regulation trails, and risk accumulates silently. On the demand side, private clinics now sell high-price bio-optimization packages that include peptide protocols, often tens of thousands of dollars per year for premium clients. Executives, celebrities, performance-driven individuals. On paper, they're wellness clients. In practice, the lines blur. Same molecules, different setting. The overlap between the legit and the gray markets is growing, and in many cases indistinguishable from the outside. If you follow the money, you trace an ecosystem: API manufacturers, contract synthesis labs, compounding pharmacies, wellness clinic chains, gray market distributors, and online sellers. Every link in the chain extracts value. Every link amplifies risk. The same raw molecules travel paths both regulated and underground. In this system, visibility is low, margins are high, and consequences are hidden. And that is the business model: low visibility, global reach, high profit. For those who understand the supply chain, this is not just a niche trade, it's a new frontier of hidden capital. Human upgrades for sale. The pitch is irresistible: faster healing, leaner muscle, deeper sleep, sharper cognition. Not next year, not after a decade of lifestyle change, but now. A shortcut to a better version of yourself. But every shortcut has a cost. In 2019, one molecule became legendary: BPC-157, a peptide fragment originally studied for gastric protection, suddenly adopted by biohackers, athletes, even executives seeking recovery. Online communities called it the Wolverine peptide. Claims emerged of torn ligaments healing in weeks, gut issues disappearing, even whispers about neuroprotective effects. Reality check: BPC-157 is not approved for human clinical use by any major regulator. It is banned by WADA under the category of unapproved substances. And US health authorities have issued warnings about peptides like this being used in compounding, citing unknown purity, unknown toxicity, and unpredictable long-term effects. Yet underground stories spread like wildfire. Some swear the peptide saved them, accelerated recovery from ACL tears, stopped chronic gut pain, brought back mobility they thought was gone. Others describe darker outcomes: nerve pain, swelling, unexpected hormonal crashes after misdosing. That's the danger of self-experimentation: no controlled dosing, no standardized purity, no safety monitoring, no pharmacovigilance, just hope and risk. Ethicists call this the new gray zone of human evolution. We're not treating disease anymore, we're enhancing the already healthy. And that raises questions with no easy answers. What counts as therapy? What counts as enhancement? Who decides? And who gets access when enhancement becomes a luxury product? Inside the legitimate pharmaceutical world, peptide drugs must pass through GMP gates: verified synthesis, impurity testing, stability reports, batch records, cold chain audits. Without these steps, a batch can't legally reach a patient. The underground market bypasses all of them. Quality fluctuates, contaminants appear, doses drift, and if something goes wrong, there is no accountability, no tracking system, no safety net. And here's the twist: peptides are already reshaping the world, not underground, but in plain sight. The blockbuster GLP-1 drugs for diabetes and weight management, the ones transforming entire pharmaceutical markets, belong to this very same family of peptide therapeutics. When a molecule class moves that much capital, the shadows follow. The gray market grows because the legitimate one proves how powerful peptides can be. This is why the industry grows. The promise is seductive, the oversight is thin, and the desire to upgrade the human body is older than modern medicine. But now, for the first time, the tools exist, and access, legal or not, is only a shipment away. The price of perfection. Every age has chased the same dream: longer life, faster healing, a version of ourselves without weakness, without limits. But in this age, the dream is no longer myth or philosophy. It's chemistry, it's data, it's peptides, tiny molecules with the power to tweak the human machine. For some, these molecules are hope, relief from pain, recovery where doctors saw none, a chance to reclaim their body. But for others, peptides are something else entirely. A doorway, a temptation, a chance to enhance, upgrade, and outperform, not because they need to, but because they can. And that is where the danger truly begins. Peptide therapeutics already move billions in legitimate markets, but the gray channels, the unregulated compounds, the optimization programs with unknown dosages, they grow beside them like a shadow empire. And in that shadow, there are no rules, no oversight, no guarantees. Human enhancement is no longer science fiction. It's a product, a commodity, a business model. The question is no longer, can we enhance the human body? The question is, should we, and who decides? Because the future of human enhancement won't be built in the spotlight. It will be built molecule by molecule, shipment by shipment, dollar by dollar, in laboratories you will never see, by people you will never meet. Whether this becomes evolution or exploitation depends on who holds the syringe. If this deep dive into the hidden world of peptides opened your eyes, subscribe for more stories about unseen power and the empires built in silence.